Hello, this is The Hills Are Not Flat, where we map the terrain of recovery. Um, I'm Richard Davis, and I'm here with Dr. Hollis, and we are going to discuss today about the emasculation process for a man who has found himself in a situation where his drinking is turned problematic. It's not quite a medical issue. It's an identity event, and it strips his agency and erodes trust and destroys social standing a little at a time. And we just want to touch on that. Dr. Hollis?
Having me here with you. I'm so excited to do this podcast with you, and hopefully it's going to touch a lot of lives, like it's not only touching yours, but myself too. Why don't you tell them a little bit about yourself, and then I'll tell them a little bit about mine, and then we'll get to the topic at hand today.
Well, I'm Richard Davis, and I'm a general contractor and developer, and have recently started a consulting firm dealing with the issues that most developers and general contractors deal with. I was in the Air Force, and I'm an Air Force veteran, and have a lot of friends that have been affected from PTSD, and trying to solve it by self-medicating. I decided to try to take this a little bit from a different perspective and talk about it from a professional perspective, as a soldier, as a medical professional, as a lawyer, as a pilot. I'm a commercial pilot as well, and there are some guys out there that they're very bread and butter depends on them staying sober in the HIMSS program. So we kind of wanted to take a different take on it. This is not necessarily a recovery program, but this is the take of what the toll that recovery and self-medicating takes on a man.
And as you know, you and I have known each other a long time. We go way back. So I feel like I know you not only professionally and all of the achievements that you've accomplished, but also personally. So I think that's why this is going to make a really, good episode, and then just a good idea moving forward, because we do know each other and, have some history when it comes to knowing each other. But, as everyone knows, I am Dr. Hollis. I have an EDD in nursing, and also a psych nurse practitioner, as far as I'm a psych nurse practitioner, and I can prescribe meds, and I treat mental illness and deal a lot in addiction daily, as well as for a small practice. And this is some of the content and struggle that I see in my patients daily. And then also just the awareness and the stigma behind mental illness is so real, especially when it comes to even like alcohol use or substance use or just trauma in general. And while we do choose to self-medicate, versus get help, and the stressors I think that women endure versus males, or, very different, and what might, make a woman choose to do it or a female choose to do it versus a male. And we'll go through some of that. But I think it's just important to get this information out, because if it touches one life, then I think we've done our job. And I think hearing your personal account, as it pertains to this content is great, Ricky. But then both of us have a lot of information and different, various other things with mental illness that we'll talk about through this podcast too. So, yeah.
Thanks for that. The one thing that I've seen in recovery, especially as it pertains to, rehabs and how these things are handled, is that it doesn't really start off. It doesn't go straight to rehab. A person doesn't just all of a sudden wake up in rehab. They don't just all of a sudden wake up and their family is standing around them and trying to have an intervention plan. It kind of starts like this. So it's the descent. It starts with social drinking and, the eyebrows being raised, where maybe your friends or your wife or your family, they kind of look at you. You got this drink in your hand, and you probably had too many drinks in your hands, and somebody says something, and then you just shrug it off and say, fine, I'll stop. And then at some point in time, you just say, I'm going to stop just to prove to everyone that I can. I just want to get everybody off my back. But that's where it starts. And what happens is that eventually you find yourself maybe 6 weeks later or 3 weeks later or 6 months later, whatever it is. And again, there you are again in the same position, and everyone's looking at you like, hey man, you need to stop. And so, but this is the most dangerous phase of the drinking or drugging or whatever your vice is whenever it turns into the closet phase. And now when it goes into the closet, it's this fast, frantic, shame driven, how much can I consume before I'm caught
So
scenario.
it starts with, just wanting to drink or have fun or fit in, yada, yada, but then it becomes shame being the centralized force of it. Would you say
Yes, of
that's
course.
true?
It's good. And here's the thing about it is that, once you're in the closet, you're having to guzzle. I mean, you're having to guzzle as much as you can because you don't know when the next time that you can get back to the closet or your truck. How many times can you say, I've got to go get something out of my truck, at a meeting or at a family function? How many times can you have to go somewhere to go get something? I mean, you maybe get 2 times, three is another eyebrow raiser. And then now all of a sudden, you're on to the lying phase, right? So now we're to the lying phase where someone eventually you guzzle too much too fast, you messed up. And the next part is that question that every man hates to come across and hear is whenever he has to lie. And it's, have you been drinking? And yeah, I mean, and then what do you do? I mean, like, do you say yes? You say no. Usually, you say no. Why? Because all of a sudden, that drinking or drug has turned over into another category. It's turned into a survival sort of mechanism, and you want to protect it, and you still want to maybe try to conserve the little bit of respect and
Dignity.
manlyhood that you have, the masculinity that you have.
Right. The dignity. So really it turns into more of an identity. So we didn't start this drinking for anything because of maybe you were just, for men, it's more they're trying to deal with stuff, cope with personal stressors. For female, it can be a little bit more emotional as far as like responses as to why, a female may pick it. So really it was more some things maybe you were interpreting or dealing with, you pick up the drink, and then you do have a lot of PTSD in your past. And I know we're going to hit on trauma at another point, but I do think a lot of the reasons for drinking, or one of the main ones, does stem from trauma in the form of self-medication. So a lot of clients, males, females alike, and not just you or me or any of it, a lot of people, self-medicate. They are they feel very shameful. They don't want to admit it to themselves. They don't know how to get out of this negative feedback loop, which it turns into, and I'll let you discuss it, and then I can discuss it from a clinical perspective, the negative feedback loop, and then how you promise that it's going to be the last time because you really, intend that and you want that for yourself, but then you haven't fixed the real things going on in the back of your mind. But you've had a lot of trauma when you're, overseas and in the war. And again, I'll let you talk about that as a veteran. And I do see a lot of that in my day-to-day clients now. They do self-medicate with the trauma that they've experienced. And then it just turns into, like I said, that negative feedback loop, and it's a downhill spiral. And then when you're in that reality or that identity, it's often, and people start to judge you in that's where the shame, the guilt, and we'll talk more in depth about that versus like other substance abuse and, disorders and the differences in that. But tell me what your thoughts are on that as far as like the trauma and the identity of it.
Well, I think it starts off that way. I think we first not to glorify AA, but Bill actually writes. Bill W. actually writes a lot about the feeling of I have arrived. There is a real feeling behind alcohol. If you feel like maybe if you were as a child, you weren't maybe you weren't accepted as much, or as even in high school or college or in the military, there was something that alcohol gave you that you were missing.
Mhm.
But whenever you start self-medicating with it, it kind of turns to a different. It's not the, oh, I'm socially lubricated and I'm going to talk about some great things that you want to listen to.
Mhm.
Uh, Whenever it turns its head, when it actually becomes self-medication to fight the demons, when it goes into the closet, whenever it turns into drinking hot vodka that's been sitting under your truck seat in 103-degree weather, and you can go out and sneak and you guzzle as much as that hot vodka as you can. It's really not that anymore. It's not a social lubricant anymore. It turns into just a coping mechanism to fight the demons, and then obviously there's a physiological aspect to it too with addiction, but I think once you get past the lying phase, and you're already this liar, you've already turned into this malicious. You're not trying to be malicious, but you turn into this liar, and you're trying to juggle all the things. Be a dad, be a good husband, be a good brother, be a good son. And at some point in time, you just start failing miserably at everything, and this is the point where most men find themselves when they try to manage their health too long and they don't get help, is they come to the hand raise moment, and they eventually say, yes, I need help. And then, you know, the initial response is the family feels relief. Everybody's, oh my God, he's going to get better. And they just really think of it as a one and done. Most people don't really understand self-medication, addiction, alcoholism. They all fit in the same category. There's a lot of other things that you can respond to later on about how codependency, runs tandem with that. But at the very first, you get this one moment where you can say, "I need help." I raise my hand, but I don't think most people understand.
That's your most
Um,
vulnerable moment. To
yeah,
me,
and
the
that
most vulnerable when you ask for help.
that's the first point of emasculation, and that's where the emasculation begins in a man. I haven't really heard anyone really touch on the emasculation process. I've heard counters to maybe being a baby, and having your diaper changed, but this is, we're real men. There's a lot of us out here that are real professionals that have real licenses that we have to protect, that we end up having the moment we raise our hand, we have to jump through all kinds of loops to keep those certificates and licenses, and it's a little bit more involved, and there's not a lot of people really talking about it. But putting your hand up, it takes a whole lot, and I'm telling you, it is emasculating to do that. But in the moment, everybody's happy, you're relieved that you finally said something. You go to rehab, and you think that they're going to put Humpty Dumpty back together again, but you know most people don't know what it means to go to rehab. The emasculation just continues to spiral even further. I mean, the rabbit hole goes so deep in that emasculation process that it's really hard to explain it without actually having a podcast like this, so that we can really talk about it.
And
uh you
something
know
else that I want to point out too, it's like, too, when you pick up that first drink to start, it's not like, yes, I'm going to do this the rest of my life. Like I aspire to, be controlled by this substance, yada, yada. It's more or less, we do it for fun as a teenager. We fit in, right? Social structures, societal norms. If you are in a job where it's sort of expected, like, and I've been in those positions before where, you're supposed to sort of, you pick up the drink and have the drink with dinner or with clients, this and that, and not this role, y'all, in a different role for me. And so it's socially acceptable. And if you don't take the drink, it looks some kind of way, and you just kind of want to fit in if you're like a lot of us. But I think it's things that sort of like initiate that first drink. You don't start it for anything, malicious intent. You're doing it just for fun or to fit in. But then the problem becomes when if there's something else going on in the background, your subconscious in your mind that you're not fully aware of. Like for you, a lot of it was the unresolved trauma from being the veteran, or for a lot of my clients, mental illness, depression, certain forms of mental illness, anxiety, can stimulate someone to pick up a drink because they're self-medicating. They don't necessarily want to come to the doctor and see us or see me for as a clinician, or any of us really, or they don't think it's a problem because the alcohol does the trick. Or if you're shy and having anxiety, right, have a drink and then you're fine. But it's like you're just setting yourself up for failure, which I know that we'll talk about, but it goes back to that. Just, making people, I want to bring this to everyone's awareness today that, you know, for anyone out there, it can just start with one drink. But if there's things going on in the background that you honestly need to like work through for yourself, whatever that looks like for you, because healing and recovery, none of this is linear. And I know Ricky can talk a lot about that too. And this is for all conditions, not just, substance abuse or alcohol abuse or alcohol misuse. It's for all conditions. There's no linear recovery here. It's different for everybody. And I think that's important to know. But the bigger that I want to bring to awareness to when it comes to like dealing with any type of substance use disorder, alcohol, pain medication, anything, is that what's going on in the background. So we use like these substances as a form of self-medication because you don't know to go and get treatment. You don't know that it could be depression or anxiety or a mental illness that could be co-occurring comorbidly with it. And typically, when it comes to like alcohol use or even substance use, is it the chicken or the egg? Like, was there depression there and that caused the self-medication negative feedback loop? Or did it start? And that's typically what happens in females. Or did it start because of other reasons? You're having fun, this and that, societal things, and then it just went down the rabbit hole, which is what we see in the male and males more frequently in terms of that. But the thing is that you don't often know, is this mental illness that could be contributing it? Like, is the depression making or the anxiety making me want to drink more? Or is it because I just don't have the ability to quit? And then it's bringing on depression and anxiety. So it's like a paradox. Did it start because of this, or is it a result of this? And that's what we treat a lot in mental health, like in my role, trying to figure out where this self-medication negative feedback loop came in, and then is it something that's going to be more therapy based, and then our ways to treat it, that which there are certain medications, and I'll talk about that later. But just to keep in mind that it doesn't always just stem because you're excited and you want to have a drink. It could be that you're using this to medicate depression or any other form of mental illness. An eating disorder is another one I see it a lot of times with, or just like you were talking about the emasculation, and then once it starts wanting to fulfill your duties, but then it's the shame, guilt, and again back to the negative feedback loop, and trying to stay your best self while this is in the background and nobody sees it or knows it, and then they're just left to judge you with it when everything comes to a head. Am I wrong?
No, I mean, by the time it gets to the point, that I'm kind of relaying, it's very dynamic at this point. I mean, at this point, it's at the very least, it's acute, right? And everyone is very very tuned into that, and that acuteness, it it sort of takes precedent of everything else. So but at this point in time, it's so dynamic after this process. Once this is sort of the middle, this is the middle part. This is like where it all begins. This is the real descent, really, and when it comes to treatment and how you're viewed. And I call it the scarlet letter. Once you have raised your hand, once you have said yes, I need to. Once everybody is past the acute phase, right, and they're on to the let's prevent the chronic relapses and going back into that same mind frame. Everybody's behind you, but now you have a label. All right. This is whenever you've crossed the line and you can no longer have a glass of wine out anywhere around anyone that you would ever, want to come in contact with that in your immediate milieu that knows you. This is the scarlet letter. This is where uh, things kind of go awry because a lot of people, 80% of people relapse within the first 6 months of abstinence after a rehab program. As a matter of fact, the numbers are really astronomical when it comes to even making it a year. I mean, less than.
Why do you think that is? Is it because of the ways that they try to micromanage you, or there's not enough research or resources? Like, why do you, what do
Well,
you
I mean,
think?
I have this theory as it pertains to alcoholism specifically, But the MAT, protocols that they have for, say, a person on heroin or on meth or any other painkillers, you know, they actually have some protocol, to give these guys a substitute to make them feel better. And sometimes, these methadone clinics, they host these guys for 2 years, and they're just pretty much taking a lighter dose of what they would have done, or just it's kind of a managed plan so they don't die, you know. But with an alcoholic, they give you a little bit of drugs to come down off of the initial throes of it all, and tell you to go to AA, and good luck, buddy. There's just not the same protocol, and I believe that we're still using Civil War medicine, to treat alcoholism today.
There's
So.
some great advances. I mean, I'm becoming more fluent with it now. It wasn't always my area of expertise, and it's because I didn't get to do a lot with addiction. Like my main focus was, depression, anxiety, like the mental disorders, but and not to say that addiction isn't, it's just very different. So now that we're seeing it come out more and more, and people are actually wanting to get help and seeking help, it's a lot easier to kind of help with the treatment, capabilities. So there's some great, on the horizon medications. There's some starts. There's a lot of things that we can do to help, but it's more of like a two-pronged approach, medication and therapy. But I do see that initial period of where you might, be so sick that you need that acute detox to save your life, but then they kind of just throw you to the wolves in the sense after that and just say, get help, go see your psychiatrist. Well, not everybody has that, or they're ashamed, or
Yeah.
there's a stigma, or they don't want to admit it to themselves, let alone everybody else. So we're back to that negative feedback loop. And there are some things to be desired for as far as resources here for like alcohol use in general. Like when you're talking about opioid use, methadone, Suboxone, these are great advances that do help patients. When we had the opioid crisis, back in 2008, I think, or years ago, to kind of come away from the opioid crisis. But then you've got other forms of things going separate of alcohol. Benzos can be a form of medication that can be addictive also. Any of the controlled stimulants per se, not as often, if you're going to go through the whole gamut. And then certainly the other hardcore drugs. But that's what I'm seeing. The treatment advances are getting better, but it's still not where it should be, because if it was, I feel like we would be able to help a lot more than what we're doing right now.
Well, yeah, I appreciate that. And that is the rehab, the treatment portion of it all, but what happens whenever we finally get out of that, right? We get out of the crying it out and hugging each other. We're still part of this culture, the Air Force, Army, Marine Corps, Navy. There's a culture of drinking, okay? And it's a masculine thing. There's a culture that doesn't allow you to raise your hand and say, hey, I've got PTSD. There's a culture that says, hey, man, let's just go out to the bar, we drink, get up. Even pilots now, the FAA has a long laundry list of drugs you can't take for this, but they still have the antiquated, 8 bottles or 8 hours bottled with throttle, which means that, as long as you blow under a point '08 and you didn't drink in the last eight hours, you can fly. And but we have all these other drugs that you cannot take that are part of regular MAT protocol for other drugs. So I think we're a long ways away from it. I don't know if it's and you spoke of chicken or egg. It's one of those things. I think there's so much money in it now that maybe there might even be some reluctance to try to fix it. Like there's a lot of people making money off of us guys, but back to the Scarlet Letter, once you've done that, and once you kind of raise your hand, and after the kumbaya is over, after all the tears have been cried, and you've laid all your stuff on the table, and you've done all your steps, and you vomited out all your egregiances, and maybe somebody didn't take your apology, and maybe some more people did, less people did, I don't know, but what happens is you go back to real life, and whether you're on the HIMSS program or you're on a protocol of being a doctor to have your license back, a nurse or a lawyer, they all the programs are similar. I think HIMSS is probably a little bit more
Mhm.
robust in that sense. But now you're fighting for your license, but it's not just that. You're fighting for your identity again too,
Your
and
self-respect, your
and your
respect,
self
your
respect.
identity,
Yeah,
your integrity. It's an identity.
and you know
That's an encompassing identity.
with your licenses, if your licenses were pulled, would that
Mhm.
not cause a vacuum in your identity?
Absolutely. It's the same in nursing. Like we can't be caught with it either or have a DUI. I mean, you can, but you're going to go to rehab and do treatment. But yeah, I mean, I can't afford to lose my license. Absolutely. Because it's, we need it. You too.
Yeah, so you wrap up your identity inside of all these things, your platform, right? You have your platform, and
Mhm.
so now you're trying to reestablish your platform, reestablish yourself in your milieu, and and in the community because people talk, right?
Right.
But here's the real problem. I mean, this is where it really goes sideways, is that everyone's expecting a one and done, and
Yeah.
they're all expecting, hey, he's a strong person. He's got all this to lose. She's got all this to lose, all these licenses. Who in the world, beautiful kids, beautiful family, why in the world would they not? They have everything to live for and everything to strive for to not mess this up. And guess what happens? You mess up.
The negative feedback. It's the shame cycle, the shame spiral, because like we said, linear is not, I mean, I'm sorry, recovery is not linear. So what it looks like for me and I've not been there, but I mean, if what it would look like for me versus patient A, B, C, D, U, whoever is going to be very different. Maybe someone could give it up right away and be like, that's it. But research shows the majority of people, it's not quite that simple because when you think in terms of like relapse, it's not a rebellious type thing. People don't do it to say, I'm going to just get back at them. There's some neurobiological things going on within the brain that are contributing. Plus, it's that shame spiral and that shame response. So again, we're back to not just one big thing, it's two big precursors here. So, I mean, I think that makes it harder to recover too, or be completely recovered.
Well, I think most guys could probably simplify it down to it just starts with this spring in your chest that gets tighter and tighter and tighter, and then outside stimulus, it just gnaws at you a little bit more than it should, and that spring is getting tighter the whole time, and you're just about ready to take off, right? You're a rocket ready to go, and by the time that you get the signal that whatever the threshold that you put inside your head that you couldn't take anymore, you're just off. And then now you betrayed everyone, right? You betrayed
Right.
everyone's trust. You promised. How could you do this? You had this. You're doing. Why would you put all this at risk? Why would you? And it's just hard. It's hard to explain it outside of being in it. What looks like complete pandemonium and just a lack of caring and a lack of regard for people. It just really doesn't feel like that in the moment. It feels like a survival skill. It feels like I got to breathe. It feels like, oh my God, I can't breathe. It feels like, oh my God, I've got something on my chest that's so heavy it's going to crush me. It feels like a survival skill that you've got to that if you don't utilize it at that moment, it's like being out in the woods, with it raining and snowing or sleeting, and you can't start a fire. It feels almost like that, and I don't know that most families are aware of that feeling, or if they can even understand what their loved one is going through whenever they kind of hit that moment. But this begins this cycle, where of this distrust, and everybody's hyper vigilant, and everybody's looking for all the cues, and you can tell. I mean, the people are looking at you differently. They want to
They're
look at your
disappointed.
eyes.
They're
Yeah,
called, and you yourself feel like a failure already, and then you're getting the disappointment from your family and feeling like you let everybody down. So the shame continues, right?
and
And just
it's the one over. You get this one over glance, looking you up and down, looking at, oh, why your eyes glass glossed over, or why you eating a mint, why you chewing gum, everything becomes ridiculed to the point to where like you really don't feel like you are a participant in that environment anymore. You
And
feel
mostly
more.
too, which was a good point, you don't feel you're losing your autonomy, your independence, your overall decision making. And as a man, as a woman too, but especially as a man, you are the primary decision maker for not only yourself but for your family in the way that you and I were brought up. And I'm certain a lot of the world was brought up. The man's the primary decision maker, so then you're not even entrusted to make the right decisions. And so then you feel like you're losing your autonomy and your independence. And then people will try to take that from you. Well, you're not sober, so you can't make the decision. Or even worse, we're going to commit you and throw you away for a year because you're a disgrace. You can't get yourself together. And we don't want to fool with you because they don't understand it's it's not just I've got to have the drink. It's just a psychological and neurobiological thing going on in the brain at this point, on top of the reasons for self-medication. So there's so many different things happening, and most people are just not familiar with it. They think just stop drinking, but it's never that simple. If it was, people would stop, right?
Yeah, and the thing is that, and the more that you alienate your loved one that's going through this, and the more that he is estranged from being an actor and a participant in his own life, the more that relief is a safe place.
Yeah,
So just imagine if a man is emasculated and he feels like he's not even the same actor in his life that he was, and constantly being ridiculed, constantly being people searching and looking for stuff, and wanting to see it on you and get these tests and that test and this test. you know After a while you start feeling like a science project, and maybe almost like a mental health patient than a participant in your own life, and that can cause a person to cascade down into dissent, and ultimately just completely ostracizing themselves from everybody, and you know you know finding themselves sleeping in the woods.
yeah, yeah,
But anyways, the whole thing is that the whole point of the message is that to try to maybe show people that have loved ones that have gone through this, that shame really never produces sobriety.
no.
Humiliation is not really accountability, and surveillance is not support. It's all about recovering agency and recovering a man's masculinity or a woman's purpose, right? I mean,
Right.
just like you said, you get taken out of those decision making factors. The same thing for a woman. You were the one taking the kids to the doctor. All of a sudden, you go, your mom's doing it or his mom's doing it. You have everyone is replacing you with somebody that they believe is more responsible, and then it doesn't even matter. And the question is when do you get it back? Like, who decides? Like, okay, so if you did the one and done and you magically were better, then maybe everyone would give that to you in 6 months. But what happens if you messed up in 6 months? Well, now it's a year. What do you do if you get a good year and you mess up again? 2 years? Like, does it have to, is it compounding? Is it exponential? Like, when do people finally decide? And that's a horrible thing to actually have to go through. And a lot of people just have to move on and start their lives fresh again. And it's a shame that's the way it is. But
And I
uh,
think too, it's such a conflict in the sense in that mental illness, if you want to look in terms, let's just use bipolar, because I have a lot of clients that I treat that have bipolar. And certainly with the right medications, they can live a very normal, productive, happy, healthy, fulfilled life. I mean, with any mental illness, you can, right? You just got to have the right support and the right treatments. Well, I feel like sometimes with, substance use or addiction or just, substances in general, um, it's not treated the same way. I would expect someone with mental illness to come say, Holly, I didn't take my meds today. Because typically the recurrent thing with bipolar is that they're feeling so great on their meds and then they're like, I don't need them. Like that was a fluke. So they come off of them. We relapse 100 times because they're on them, they're off them, they're on them, they're off. I get them back, feeling very good about their treatment. Things are great. They're feeling great. And then they're like, I don't need them. So we do this process multiple times, but why is that any different from the process that you endure? Why should it be held to a different standard? I'm just using that as an example, a bipolar patient, depression client, whoever is taking their meds, but then they feel better, they don't need them. We do this cycle. So why is it any different for someone recovering from alcoholism or that has to face it? Like it's a lifelong thing, but it doesn't mean that you can't function normally and have a great life. It's just the way the stigma is and the way that, it's looked at. And so it's because of that shame, I think. And then people, literally family members get so angry and so upset and so hurt. But I think that they see that a lot with addiction, but they're also not seeing it from my perspective in that I see it in all forms of mental illness and how people relapse quite a bit. I mean, that's not the goal here, but it happens. And I think
Yeah.
that's what we have to remember is that having an addiction to a substance is oftentimes a lot like coming off meds. Even for like, I don't know, you can say medical illness too. I have a lot of clients that are like, my blood pressure was good, I don't need it. And then their blood pressure skyrocketed. The med was helping. So how is any of this any different? And why do we treat anybody any different when we should all just love and support each other and want them to just do the best they can and not put these, I don't know, um, these labels on them?
Well, I do want to say that I am a proponent for 12 step, and I do believe, and I want to discuss this maybe in another podcast, but I believe that a man or a woman that is going through this, they can use the safety net or the safety protocol for recovery to kind of show progress in people that are you know that are a little bit hesitant to give them any grace. So I mean, it has its place, and I do believe that that being able to have these protocols in place and work these programs, it's not just about getting back on your feet with yourself and getting your identity back, but I do believe that it can help soothe some of those that anxiety in family members and friends by seeing that there's kind of proof in the pudding. But I do believe that we do need to have a little bit more grace when it comes to medicating some of this stuff though as we go. And instead of the Civil War, let's give somebody something that makes them throw up if they drink. There needs to be more a little bit more MAT protocol for the alcoholic, just like there are for a lot of other mental health challenges, and obviously, like you said before, treating that underlying condition and figuring what that is. The hope is that you can stay abstinent long enough to eventually kind of heal all these things and find out what that underlying condition is long enough to maybe treat that and keep the negative or the feedback loop from winding itself back up and turning over again. So
Because the important thing to remember is that I do have a lot of clients that come to me that have comorbid mental illness plus, alcohol use or substance use disorder. And the key thing here is that we have to treat the substance use first because it goes back again. Is it the chicken or the egg? What came first? And they do occur comorbidly a lot because of that self-medication component. But once they're safe, physically, as far as like, they're not in any risk of withdrawals or death or dying, then we come back and they do, discuss like the depression or things going on, and we're able to treat that. And then I have really good outcomes moving forward. So I think a lot of times, not just awareness, but identification, and just knowing. And a lot of times too, and I had to check this when I first became a clinician 8 years ago, the stigma, like I had to let all preconceived notions because human is a human, right? And we're all going to make our own decisions and our own choices. And it's like, you don't want to be judged for that. And I certainly would never, ever make my clients feel any one way or another because maybe they made this decision and it wasn't the best thing for them. Okay, well, we're going to fix it. I think the bigger take home from today is that, just be open to it and that anything can be fixed or helped with the right support and guidance and systems. you know, and the bigger thing too, when you're looking at evidence-based care, because this is important, is to do a thorough trauma assessment. When I say that trauma is oftentimes what I see most predominantly associated with substance use disorder, I'm not kidding. Like my veterans are at my most risk. And then a lot of trauma surrounding like different, I don't know, abusive behaviors, sexual behaviors, um, physical abuse, emotional abuse, any type of abuse. I see that quite a bit in trauma, and then substance use. There is medications we can do to help. Obviously, therapy, is a gold standard, the medication and the therapy, helping you to rebuild your identity, from I'm not someone that's broken, that can't come back from this, to someone that can do anything again. Who were you before drinking was ever even involved, and I know who you were, and you do too. And this isn't just about you, it's about everybody. Like, you want to be the person you were before it took you down that path, right?
Well, don't get me wrong. It was a lot of fun while it lasted.
I'm certain
I
it
mean, if it didn't work, I mean, nobody would do it, right?
was.
So I mean, it just kind of worked until it didn't.
Yeah.
Yeah. Well, okay. Well, thanks for coming on, and we've got a few more podcasts lined up for the rest of December, and
Yeah.
we'd be happy to have you join us. Um, and remember, the hills are not flat. Keep climbing.